Uterine fibroids are non-cancerous growths that appear in the uterus. Here are some common ultrasound features of uterine fibroids. 1. Echo-texture fibroids typically appear as well-defined, solid masses with a homogeneous echo texture, which may be hyperechoic brighter, isoechoic same brightness, or hypoechoic darker compared to the surrounding myometrium uterine muscle. 2. Size and shape fibroids can vary in size and shape, from small and spherical to large and irregular. 3. Location: they can occur in various locations within the uterus, including intramural within the uterine wall, submucosal just beneath the uterine lining, subserosal just beneath the outer uterine layer, pedunculated attached to the For borders, fibroids usually have well-defined borders but may appear irregular or infiltrative in some cases. 5. Calcifications: some fibroids may exhibit calcifications, which appear as bright, echo-dense foci or rings. 6. Blood flow: Doppler ultrasound may reveal minimal or no blood flow within the fibroid, helping distinguish it from other uterine lesions. 7. Shadowing: large fibroids can cause posterior acoustic shadowing, making it difficult to visualize structures behind them. 8. Displacement: fibroids can displace surrounding uterine tissue and distort the uterine cavity. Keep in mind that ultrasound features may vary depending on the size, location, and type of fibroid. A healthcare professional or radiologist should interpret ultrasound images to ensure accurate diagnosis and appropriate management.